Many gardeners encounter this issue during plant growth. This issue is sometimes related to Streptomyces scabies. Common indications include symptoms are not visible on the upper parts of the plant, such as leaves, stems, or petioles. Typically, the first signs of the disease are visible on the surface of young tubers and spread as they mature, leading to the following symptoms. Reddish-brown discoloration covering large areas of skin. Rough reddish-brown skin, dark discoloration. More or less deep pits. And a series of reticulated cracks. A tuber may have more than one type of lesion. Other tuber and taproot crops may be affected, such as sugar beets, carrots, yellow radishes, and turnips. In all cases, it causes reduced tuber quality and decreased yield. It often develops under certain conditions, such as symptoms caused by Streptomyces scabies bacteria, which survive in infected root tissue in the soil. It spreads through water, through infected branches and leaves, and through wind-blown soil. It enters plant tissues and tubers primarily through natural wounds and crevices. Dry and warm weather during tuber development increases the risk of infection. Because the bacteria require a large amount of oxygen, the probability of infection is higher in loose and well-drained soil. This bacterium is most prevalent in dry and alkaline soils. Potato varieties also differ in susceptibility to S. scabies, and some resistant plants have been shown to have fewer pores, tougher pores, and thicker skin. Natural remedies that may help include treating potato plants with organic fertilizer, worm tea, or a combination of both significantly reduces the severity of common tuber scab. Biofertilizers based on competing bacterial strains can increase both yield and tuber quality. If the condition continues to spread, some treatments may involve. If possible, always consider a combination of preventative and biological treatments. Potato scab is difficult to treat chemically as it often injures the plant. Seed treatments with fluazinam, chlorothalonil, and mancozeb have shown the lowest infection rates. For better prevention in the future, plant disease-resistant varieties. Ensure crop rotation with good symbiotic plants. Maintain good soil moisture by watering regularly and avoiding overwatering. Keep soil pH low with a specific fertilization plan. For example, apply elemental sulfur, gypsum, or ammonium sulfate to maintain low soil pH and reduce disease severity. Do not apply lime before planting. The key point is that there are no symptoms on the upper parts of the plant. Brown blisters appear on the surface of the potato. Shallow to deep holes and mesh-like cracks appear on the potato tubers. For more plant care tips, consider following this channel.